Hi there, and welcome. My name is Dr. Calliope. I'm going to be performing your pulmonary examination today. Did you get it okay? Yeah, I hear that feels like temperatures. The heat index is 110, so sounds like everybody's melting there a little bit. Would you mind if I just grab a few confirming details? Okay. Your name? Date of birth? And is that your preferred name, or do you have another name you like to go by? Okay. Very good. So, I was looking at your referral notes here, and it looks like we have a chief complaint of a sort of wheeze. Is that correct? Okay, and your PCB had noted that, right? Okay. When did this start? Okay. And any particular triggers to that you've noticed? Exercise, okay. That's a big one. All right, anything else? Okay, just that. And any other symptoms associated with that wheeze? Shortness of breath. And chest tightness. Okay, let me just check at your vital signs we got. So, oxygen saturation looks great. Pulse well within normal limits, as well as temperature and blood pressure. So, we are going to be looking at the state of your respiratory system then. We will take a little look at a diagram, and I'll just show you what we're kind of looking at, what we're looking for. We are going to take a look at you as a whole. We'll look at your hands, your face, your neck, and obviously the anterior chest wall, as well as the posterior chest wall. So we'll do some stethoscope, we'll do some percussion, things like that. Then our final thing, we are going to want to do some spirometry, which basically means we're just going to test your breathing function, if you will. Okay. All right, let's go ahead and bring out that diagram of ours. So here's our little diagram of the lungs. So it is a little more on the artistic side. These lobes here would be a little bigger. Our fissure would be more up here as opposed to down here. But I think for this purpose, it'll do just fine. So these are our lungs. What is not pictured here is the diaphragm, but the diaphragm is very important because our lungs cannot pull in air on their own. But what the diaphragm does is quite literally suck the air into the trachea, down into the bronchi here, into the secondary bronchi, the tertiary bronchi, all the way to the alveoli. These little ball-like structures here almost look like bunches of grapes. So we have 5 lobes total in the lungs here, and we have 3 on the right side. We have 2 on the left side. Why do you think we have 2 on the left side? Because we need room for the heart right here. So this little space here, that is our little notch in the lungs so that the heart can sit right in here. These little areas illustrate kind of the back of the lungs. So we have our diaphragm pull the air in through the trachea, we have the tracheal rings and bronchi rings here. Pull them in, travels to the bronchi, and where we get the gas exchange, where we pull in the oxygen to oxygenate our blood, that's where the alveoli come into play. So here we have our superior lobe, we have our medial lobe and our inferior lobe here, and then we have a superior and inferior lobe on this side, right here. So I am going to be taking a listen to all these little areas. We have the apices of the lungs. We'll be listening along these areas, and I'll listen to the sides of your chest too, so I can get the sides of the lobes. And funnily enough, we can see some anatomical variations, if you will, in the lungs. We can see it in all parts of the body, but in some places we don't have the fissures, these little dividers between the lobes. They're not fully formed. They may be partially absent. We can also see where the right lung actually only has 2 lobes, but the left lobe has 3 lobes instead. They just make it work. The body is absolutely excellent at just making things work. So let's go ahead and take a little look at you. So I'm just going to look at you as a whole. Look at your skin for signs of cyanosis, for example. I'm going to kind of listen to your breathing a little bit, see if there are obvious signs of that wheeze, if there's a stridor, if I can tell you're short of breath, if you happen to have a cough or anything like that. And we're looking for signs of edema. We're looking for muscle loss at all, which you haven't been experiencing any sort of odd swelling or muscle loss, right? Good. Okay, so then we are going to start by looking at your hands. It's a very important part, about the state of your health. So let me show you what I'm looking for, and then we'll look at your hands. So we're going to look at both the backs of the hands as well as the palms of the hands here. So what I'm going to be looking at, firstly, we're going to look at the color of the skin and the nails. We want it to not be any sort of pale or bluish tone to it. We are also going to look at the nails. We're going to look for any tar staining, which is indicative of smoking. And we all know smoking is not very good for the lungs at all. And we are also going to look for skin changes. We might see bruising or thinning of the skin with steroid use, like in an asthma inhaler. We also are looking for joint swelling or deformities in the joints from rheumatoid arthritis, which can have effects on the respiratory system. So we'll check your joints, see if they have any swelling to them, if we've got like any swan necking, for example. And the last thing we want to check is going to be, there is this little angle in the nail. You have the nail, and then it comes up a little bit, and then it forms into the finger. So this little window here, if you put your fingers together, you should be able to see that little bit of light right in there, that little window. So if we do not have that window, if we lose that angle between the nail and the skin there, then that is something called finger clubbing. So that's something we also want to look for. We're also going to check your pulse here. So we'll come at the radial artery, and right here with the tips of my 2 fingers, we can feel that pulse. We can feel the quality of the pulse as well as the speed here. So let's go ahead and take a look at your hands. So as we had looked before, we're looking for color changes, looking for that pallor. We are looking for skin changes, tar staining, and joint swelling, which your hands look pretty good. And I showed you that little angle with the fingernails to check for clipping. Would you mind just doing this real quick so I can see if that little window is still intact? Okay, and it is. That's good. So let me go ahead and just check the temperature of your arms. I'll use the back of my hand. I just want to make sure everything is warm. And it is indeed quite warm. So let's go ahead and check for a tremor. So our first one is going to be a fine tremor. If I could just have you extend your hands out and just hold them still. Now, I have a bit of a tremor myself, so likely your hands are not going to look like this, but I just want to make sure that you do not. There are a lot of people that do have a tremor that really is not indicative of anything. Mine was from a medication I took a long time ago. And you do not have a fine tremor. I'm going to have you cock your wrists back, and we're going to look for a flapping tremor. So if you keep your arm like this for about 30 seconds, it should stay like that. In a flapping tremor, it will go like that. So pull the wrist back, and we'll just watch for that sort of tremor. And that could be a sign of carbon dioxide retention. Okay, you can go ahead and put your hands down, and we will just check the pulse rate here. So if I could just put my fingers right here. Okay, and we're going to check our pulse. I'm just going to be counting along in my head. There we go. Good. Okay. Just a little bit longer. Just a little bit. Okay. So the pulse is about the same as earlier, and our respiratory rate, 16 breaths per minute, which is within normal levels as well. So I am going to have you lean back against our table there. So you will be at about a 45-degree angle. I'm going to have you turn your head to your left. We're going to look at the jugular venous pressure. Okay, so if you could just turn your head to the left. Good. Okay, so I'm going to be taking a look right here. We're going to look at the internal jugular vein here. And I want to make sure that it's around 3 centimeters between the top of that pulsation and the sternal angle. Okay, I'm just looking at my landmarks here. Good. Good, okay. And that distance there, that's good. Okay. Now, real quick, I want to also check for a hepatojugular reflux. So what I'm going to do is I am going to press on your liver and I'm going to watch your neck here, okay? Do you have any pain in your abdomen at all? Alrighty, so I'm going to be pressing right in here, okay? So, nice firm pressure. And we're just going to hold for a few seconds. Let off. Okay, good. All right. Jugular reflux test. Very good. Let's take a peek at your face, at your eyes, and your mouth. So, just going to look at the face. Good coloring. And you could just look at my nose. Okay, and I am going to pull down your eyelids. You don't need to do anything. I'm just going to pull down. Pull down. Okay. Conjunctival tissue is a normal color as well. I'm going to pull up. Pull up. Pull up. Good. Okay. Now, if I could have you just open your mouth and put the tip of your tongue to the roof of your mouth so I can look at that vein underneath. Okay. Good. Alrighty. Okay, you can go ahead and close your mouth then. And your lips are also of a normal color. They're not dusky, no bluish tinge to them. So we're not dealing with any sort of cyanosis. So next we are going to be looking at the chest wall. We are going to focus fully on the anterior chest wall, and then later we'll get to the back. So I'm just going to look here. We are checking for mainly scars and deformities. So some things you can get where the chest looks caved in, where it is protruding, or you can get a barrel chest, for example. So I'm just taking a peek at everything here, and the chest looks to be of normal appearance. So that's good. And then we want to just take a little detour to the neck. I would like to assess the tracheal position here. And this is going to be a little uncomfortable. It's always going to be a little not fun when you are poking around the front of the neck. So I'm going to be very gentle, and I'm going to go one side at a time. So I am just going to make sure this is midline, that there is no deviation, and it is right in the middle there. So that's good. Now I'm going to assess the cricosternal distance here. So that is from the sternal notch to the inferior border of the cricoid cartilage in the neck. So if I could just see your fingers real quick, because our guideline is 3 to 4 fingers, but that's your own fingers. I have very small fingers. So if you have bigger fingers than mine, and you do have bigger fingers. So I'm going to just use your hand here if you don't mind. If you could just keep your hand like that. Okay, I'm going to put you right here. So here's our sternal notch there. And then that is indeed 3 fingers right there. Okay, you can take your hand back. We had 3 of the patient's fingers for our cricosternal distance. Okay. Now, we're going to do a little more jumping around. We're going to do some palpation of the chest. Very first thing, we want to look for the apex beat of the heart. I am going to count out the intercostal spaces until we get to the 5th. Those are the spaces between your ribs. So from here, we're going to go 1, 2, 3, 4, and 5. And then the mid-clavicular line. So clavicle here, mid-clavicular, right there. And we're going to feel for that. There are numerous reasons why it could be displaced. So we want to make sure that it is not. And it does not seem to be. Okay. Apex beat. And then we're going to do some chest expansion testing. I'm going to put my hands around your chest so that when you breathe in, they will move apart. My thumbs here will move apart and come back in as you exhale. Now, I might get one that moves more asymmetrically, or it might not go very far. So we want to see if that's an issue at all. So I'm going to put my hands right here, and it is going to be quite tight, okay? I'm going to have you take a deep breath in and out. Good. Let's go right here. Deep breath in and out. Are you experiencing any shortness of breath with that deep breathing? Okay, do let me know if at any point you do, alright? So, let's go ahead and do some percussion, then we'll bring out the stethoscope. So, percussion is going to be tapping along your chest. I am going to do a little maneuver like this. Listening for the sounds that come back. So this technique was actually developed from people that would tap on barrels to assess how much fluid was in them, how much liquid there was. So we could have a resonant tone, which is normal. We could have hyperresonance, a dullness, or a stony dullness. And the sound will get duller as we go down the chest wall, but for the most part, it should be resonant. So we're going to start at the lung apices and work down. Okay. So right here, just going to be tapping along here. Good. Always comparing one side to the other. Could you please lift your arms up so I can get to the axilla? Okay. Good. You can put your arms down. Now let's grab our stethoscope here. We'll be listening for a few different things. So We want to see if we can hear that wheeze. We want to see if we can hear stridor. That sound can happen, for example, if there is an obstruction in the airway. We can listen for crackles. We have coarse crackles or fine crackles, which sounds like if you rub your hair together. That's what a fine crackle sounds like. And then we also have rhonchi or rales. So, pop this in. I'm going to have you take a deep breath when I put the stethoscope on your chest, and I'll prompt you. We're going to start with the bell on the apices here. Deep breath in and out. Deep breath in, out. We'll switch to the diaphragm. Deep breath in, out. Deep breath in and out. Take an inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Deep breath in and out. Deep breath in and out. Okay. Lift up your arms again for me. Thank you. Deep breath in. Out. Deep breath in. Out. Deep breath in and out. Deep breath in and out. Okay. Now we are going to test vocal resonance in the lungs. So as I put the stethoscope on your chest, I'm going to have you say the word 99. And that way I can listen to what the sound sounds like in your lungs, if there's any hyperresonance or any dullness to it. I'll just put this on the bell here. If you could say 99. 99. Turn it to the diaphragm here. 99. 99. 99. 99. 99. 99. 99. My. So, before we turn you around and bring the stethoscope back out, I just want to assess the lymph nodes real quick. So, I'm going to do this. Is I am going to feel with the pads of my fingers. I'm going to come up underneath the chin to start. So we've got submental here, submandibular, we'll go preauricular, postauricular, work on the neck and the supraclavicular nodes as well. So, submental here, submandibular, preauricular, postauricular. Good, and then let's come down. So let's go ahead and just do our anterior cervical chain, posterior cervical, and our deep cervical nodes. And then can I have you tilt your head to one side so I can get into the supraclavicular nodes here? Just tilt. Good. Okay, and the other side. Good. Okay, excellent. Now, we're going to be taking a peek at the posterior chest wall. Everything we did on the anterior chest, we're going to do back there. Now, what I will have you do is cross your arms over your chest because that spreads the back apart so that we have more room to work with, okay? So if I could have you just turn around, okay, and we'll start with our inspection. So let's take a peek here. Okay, I am not seeing any scars, any skin abnormalities, or structural abnormalities. Good. Now we're going to assess for that chest expansion again. So I'm going to put my hands around your chest real tight. And I'm going to have you take a deep breath in and out. Excellent. Again, deep breath in and out. Okay, one more time. Deep breath in and out. Good. So, good expansion, and also I had the symmetrical movement, which is excellent. So, let's go ahead and just jot that down, and then we'll get to our percussion. Posterior chest. Good. Excellent. Percussion here. Just like we did before. I'm going to start at the top here. Each side. Good. Just working our way down. There we go. Yep. If I could have you take a deep breath in and out. 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 nice and easy. Deep breath in. Deep breath in and out. Deep breath in and out. Okay. Last thing on the posterior chest wall. I am going to do that vocal resonance test again. So if I can have you say 99. 99, 99, 99, 99, 99. Excellent. We have a couple more places to hit. So, first I am just going to check around your sacrum here for any edema in this area, any swelling. Okay, that feels okay. If I can have you flip back around. Okay. And then we are going to take a look at your legs. Very first thing, I want to look for any pedal edema or swelling in the feet, the ankles. If there's any pitting edema, which means if I press into it and then come back, that there will be an impression left. Not very fun, I know. So we'll start with one foot here. Okay, and the other. Good. So we're going to check real quick for deep vein thrombosis. And I'm going to check the temperature of your legs. That all feels normal. And I'm going to squeeze your calves. Let me know if this is painful. Anything? Okay, very good. So now we are going to do our spirometry. So let me just get my notes ready for that, as well as our program here. Good. Okay, that's ready to go. And I'm going to have you hold on to this, okay? Good. And I am going to tell you when to start. What you're going to do, you are going to take the deepest breath possible. Fill your lungs as much as you can. Then you're going to expel that, blast it out as hard as you can, and for as long as you can, okay? And then we're going to do a very quick breath in. We're going to do that a few times. All right. Okay, so go ahead and just keep this little tool right here. All right. Now, I'm going to have you just take a couple of normal breaths. Just relax. Just nice and easy. Okay? All right, I'm going to tell you when to go. You're going to start by taking the deepest breath possible. So go ahead and take a deep breath. Deep, deep, deep. Fill your entire lungs with air. Okay? And now you're going to blast out all that air as hard as you can. Okay, go. Keep going. Keep going. Keep going. Keep going. Okay, now take a real quick and then go ahead and relax again. All right, so a few normal breaths. Here. Looks like we're picking up. That was a good one. So we're going to do that again. Go ahead and take deepest breath possible. Fill your lungs, fill your entire lungs, and then blast it out. Keep going. We want to expel all the air out of your lungs. All of the air. And then quick breath in. Good. Now, let's go ahead and relax. And we're just going to do this one more time. Just go ahead and relax. A few normal breaths here. Just nice and easy. Okay, so go ahead. We're going to take one last very deep breath. Go ahead. Deep breath. Good. And blow out all the air hard as you can. Going. I know it's hard. Okay. And fast one in. There we go. Okay. Let me just check. We got him there. So I'm going to take this from you. And we are going to have a little discussion. Okay? I did not hear that wheezing this time, but based on your history and what we did with your lungs, I think we need to start talking about something called stress-related asthma. And asthma is a condition in which your airways get inflamed, they narrow, they start swelling up, and your body produces mucus, which will make it very hard to breathe. And asthma is often very easily controlled, and we have a whole range of medicines to treat it. There are a lot of things that we can do with it, but we do have to remember it is still a serious condition. So we want to stay on top of it. Luckily, you seem to just have the stress-related type, which means that there is a trigger here, and just the one so far, just the exercise. And we are going to prescribe you an inhaler. So this is a rescue inhaler. It is albuterol. So we want to do an albuterol inhaler. These are good for 1 year, and I can write a script for a couple of them. That way you can keep them within easy reach. And if you start to feel that short of breath feeling, you get that wheezing, you can't catch your breath, that's when you use the inhaler. We're going to start. We're going to do 1 puff for every 8 hours. So very likely you'll just need the one. And then if you need to do it again, we need at least 8 hours to elapse. We're going to start with that. I want you to keep an eye on it. We can up that if we need to, but for right now, I think with how mild it is, that should keep you good for a while. So, something you will want to be aware of. Now, this is not necessarily a trigger for everyone, but you won't have to deal with this for a bit of time yet, so you might forget. Cold air is another big trigger too. So watch in the fall and winter. And if you're having more and more issues breathing, then we're going to want to reassess. Okay? All right. So, do you have any questions for me at all? All right. No, just pretty mild asthma. I think this will be well controlled on our inhaler. You might not have to use it very much at all. It might just be something where once in a while when you're exercising, you need to take it. And that'll work. Okay, well, I'm going to go ahead and keep your PCP posted on this and make sure they know what's going on. And I'll go ahead and sign off. Okay. Well, I would like to thank you so much for coming into the office today. I'm glad we got everything sorted out. I'm glad that we got everything figured, okay? All right. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, you can check out my Patreon in the description box below. I offer ad-free access to videos, early access, Patreon exclusives, and audio